AI Model, Patient Risk Analysis. AI Model Architect, Pradeep K. Suri. AI Model AI Brain Doctor's Point of View, Medical Analysis. Clipboard Patient Risk Report, Top Table. Columns, Patient ID, Name, Age, Heart Rate, BPM, Oxygen Level, Percent, and Risk Category. Color Coding. Red square red, high risk, requires immediate medical attention. Yellow square yellow, medium risk, monitor closely, potential for escalation. Green square green, low risk, stable, normal readings. Microscope key observations. High risk patients. Patient 4, high HR, 77 BPM, and low O2, 97%, for age 53. Patient 11, high HR, 87 BPM, and low O2, 90%, likely hypoxia. Low risk patients, example patients 2, 6, 8. Balanced HR and high oxygen saturation, above 95%. Medium risk patients. Patients like P001, P005, P010, P012 show moderately elevated heart rate or borderline oxygen levels. Magnifying glass tilted right clinical insight. Heart rate, normal is 60 to 100 BPM. Over 100 BPM may indicate stress, fever, or cardiovascular issues. Oxygen level, normal SpO2 is 95 to 100%. Below 92% could indicate respiratory distress or lung disease. Combined assessment determines risk category, not just one vital. Man-standing patient's point of view, visual understanding. Bar chart vital analysis chart, bottom graph. Orange bars, show heart rate, BPM. Blue line, shows oxygen level, percent, smoother trend for easy comparison. AI Brain how to read it? Patients can see who is above normal heart rate, example patient 5 with 108 BPM. Patients can see how oxygen level drops relative to heart rate spikes, example patient 11. A balanced bar and line indicates good health, example patient 2. Pushpin summary. Perspective what to focus on. Doctor analyze anomalies, track high-risk individuals, plan interventions. Patient understand where they stand in health, visually, recognize if they're in the red/yellow/green zone. What this program can do. Displays a table of 20 patients. Assigns each a random risk category. Uses color coding to highlight. Red circle high risk equals tomato red. Yellow circle medium risk equals gold. Green circle low risk equals light green. Dark themed layout for consistency with your neural network graph. White heavy check mark recommended columns to add. 1 DNA chronic disease. Purpose, indicates whether the patient has long-term conditions, example diabetes, hypertension, COPD. Values, yes/no or list, example diabetes, hypertension. Usage. Helps doctors prioritize patients with comorbidities. Allows risk scoring models to adjust based on existing conditions. 2 beating heart blood pressure, systolic/diastolic. Purpose, adds a cardiovascular parameter to complement heart rate. Values, example 120/80 mmHg. Risk flags. High BP, example 140/90, equals potential stroke/cardiac risk. Low BP, 90/60ths, equals could indicate shock, dehydration. 3 bar chart predicted probability score, risk percent. Purpose, AI/ML generated score for likelihood of health deterioration or risk of emergency. Values, 0%, 100%, example 78.4%. Usage. Doctors use it for proactive monitoring and early intervention. Patients can understand risk in a simplified percentile format. AI Brain example, expanded table. Patient ID age HR, BPM, O2, percent. Risk category chronic disease BP, mmHg, predicted risk percent. P00 148 80 96 medium risk diabetes 145/92 62.5%. P00 453 77 97 high risk none 120/80 79.3%. P0 11 34 87 90 high risk asthma 118/76 84.7%. Thank you.